The Canadian Medical Association is updating guidelines on treating childhood obesity for the first time in nearly 2 decades. It comes after a 4-year study of patients, families, and healthcare providers. There are 10 clinical recommendations and 9 good practice statements in the update, which emphasize a family-centric care model. The guidelines also suggest managing obesity be based on health outcomes and aim to lower the priority on weight goals that are based on appearance. For more on this, we're joined live by Dr. Dina Kulik, pediatrician and pediatrics emergency physician, also the founder of Kid Crew Medical. Good to see you, doctor. Thanks for being with us.
You're welcome.
Hard to believe that it's been decades since the last update. I want to ask you what jumps out at you here, because for a lot of families, it may be that taking weight loss drugs like Ozempic, that is an option on the table now, as well as surgery if necessary.
Yeah, these are options, but they usually happen after we've made approaches such as modifying the diet when necessary, making sure that we are moving our bodies regularly, at least 1 hour of heart-racing activity per day, mindful of excess calories such as things like juice or pop, and really having a whole family involvement. That's really important because we move around with our kids are going to move around with us. And if we are sedentary at home, our kids will model that as well. So a whole family approach, not really focusing on the number on the scale, but rather living healthy, active lifestyles, feeling good in our bodies, and not just focusing on the number.
Right. And I want to come back to that first question. When options like weight loss drugs and surgery are presented, it's a last resort, right? Who would that apply to, doctor?
So for children that have already had significant intervention with people like nutritionists or dietitians or other allied health clinicians, where we're simply not really moving the needle in terms of healthy lifestyle, or a child remains obese despite intervention in the realm of dietary management and exercise, if we still are dealing with obesity and sometimes the sequela of obesity, that's when a healthcare provider may choose to start medication. But as it is with adults as well, this is something that we work on with behavior modification first, and when appropriate, add in medications to the mix.
Right. As part of the recommendations, there's a huge emphasis on the psychological component here and making sure that children seek counseling for behavioral change. What stands out to you there?
Well, I think this is cause and effect, of course, right? So if you're someone that's heavier, you may receive negative feedback from friends or teachers or parents or other caregivers, and this can have a significant negative mental health impact. But similarly, we know that anxiety, depression, other mental health concerns sometimes could lead to obesity through eating, emotional eating, or being less active than one could be. So we always want to make sure that kids that are obese and kids that are not have the best mental health that they can through working with your healthcare provider, working with mental health clinicians as well.
The new guidelines also talk a lot about the stigma that's associated with child obesity. Do you see that in your practice, and how do you approach that?
Very much so. I think a lot of kids come in feeling that they are, not as healthy or not as good. Some people will tell me that they feel less good about themselves. It can certainly impact your self-esteem or your self-confidence. If you're a heavier child, a lot of kids feel like different than their peers, or why does that person get to eat the same foods, but they are not overweight, but I myself am overweight because of whatever I'm doing that might be different or the same as my peers. I think it's hard to grow up and feel different in any different capacity. And certainly I hear from young people I see that are overweight or obese that they have these same challenges.
Yeah, so important to talk about it. Dr. Dina Kulik, pediatrician and pediatrics emergency physician, thanks so much for your time and perspective as always.